What causes depression or anxiety?
So anxiety and depression are two completely different things, but the factors that can cause them may be similar. We can divide these factors into 4 different groups. The first group is psychological factors. The second group is the biological factors. The third one can be defined as social factors, like your family, the environment you were born into. And the last one is actually related only to depression, is the genetical factors. In fact, there are some people who are more likely to have depression instead of others. It's like written inside your DNA.
What are the different types of depression that are prevalent?
So, of course, depression is different from a person to another one. But in this case, we are going to divide depression into 2 different types. The first one is related to genetical cause. There can be persons who are born with depression and they don't know why their life is just like that. They can have some relatives who have already had depression. So it's really, they feel a void inside their lives, and it's written inside their DNA. There is not a single and precise event that causes depression inside their lives. Whereas in the second type of depression, an example of the second type of depression can be like a mother who lost her sons, and in this case we can define it as depression if it lasts more than 2-3 weeks. It has to last more than a year, because depression is really a way of living things, a way of living life that really changes a person's life.
What are the symptoms of someone suffering from depression?
In order to help someone that is suffering from depression, we should help encouraging him or her with kindness and understanding to seek professional help.
What such change may be present in a friend suffering mental health?
Most of the people that are thinking about this tragic solution were already suffering from depression. Despite the difference between each case, there are some signs which are common. For example, some self-destructive attitudes like drug addiction, the indifference for friends, family and material possession, and the sense of chronic sadness.
How do I create an environment where my friends feel free to talk to me if they have any hands-on mental problem related issues?
If I want my friends to feel free to talk to me when they have mental health related issues, I will create an environment where there's no prejudice against mental problem. I also try to create an serene and relaxing atmosphere, talking together about the problems, maybe with a cup of tea or a coffee.
If I notice that someone close to me is suffering from a mental health related issues, what do I do?
If I notice someone close to me who is suffering from a mental health related issue, I would try to talk together about his problem. Then I try looking for a program that can help him to heal.
How should I speak in order to help someone with a mental health problem like depression or anxiety?
The symptoms of depression are varied, and to facilitate their identification, they can be grouped into 5 main categories. Cognitive symptoms are reduced ability to concentrate or even take small decisions. There may be distractibility or memory difficulties, but also a very strong tendency to blame, devalue, and feel unworthy. As for the affective symptoms, generally, the suffering of depression have a marked sadness almost daily. There seems to be a real pain of living, which leads not to being able to enjoy anything anymore. Also, hobbies or activities that were previously actively sought. Among the motivational symptoms of depression, there is a marked fatigue, whereby the person feel exhausted and tired, even in the absence of motor activity. Smaller tasks seems to require considerable effort, and efficiency in their performance can be reduced. In the behavioral symptoms of depression, we can find an increased or decreased in appetite. Some people may wake up early, have frequent nocturnal awakenings, or struggle to fall asleep without feeling rested in the morning. And while others sleeps too much, and this is called hypersomnia. There may also be a marked motor slowdown, which can manifest itself as a greater slowness in doing things and in speech. Finally, the physical symptoms of depression can be considered headache, palpitation, or tachycardia, muscle bone, joint and abdominal pain, and people may feel dizzy or lightheaded.
How to identify someone that may be having suicidal thoughts?
It is not always obvious to recognize the signs that indicate the presence of a psychic difficulty. However, a psychic crisis is often accompanied by changes in the behavior or perceptions. For example, a change in the mood, like low morale, excessive joy, nervousness, irritability, or distress, but also sleep disturbances, like difficulty in sleeping or getting up in the morning. But also there can be found a loss of appetite, lack of motivation, withdrawn, or even have confused ideas, no longer trust to your family and friends, or have thoughts that others struggle to understand. Other examples are feel targeted by what is being said or happening around you, and feel bad in your own skin, and have bad thoughts, have fear of losing control over the uses of alcohol, drugs, or medicines.
What are the relevant authorities in your country that can be made contact for help in case of someone has severe depression and in case of an emergency, along with contact numbers?
First of all, in case of depression, the main thing suggested to do is to contact the general practitioner, who knows you better than any other doctor and have also the trust of their patients. Anyway, in case of emergency, in Italy you can call the emergency medical service phone number, that is 118, besides a specific phone number for psychologists and psychotherapists, who you can ask for help to. That is 800 833 833.
Best general practice to minimize mental health disorders in society.
In order to help people with mental disorders, the best thing society can do is to talk about this topic, treating it like any other diseases. To talk as much as possible at school and in general about it, so that people can take it without any embarrassment and not hide it for fear of judgment, but try as soon as possible to solve any problem.